Hi, I'm Jen Roberts. Thanks for joining me today. Today we're going to be discussing the baseline care plan. As we know, the baseline care plan needs to be completed within 48 hours of your patient's admission to the facility. Typically, the admitting nurse will create the baseline care plan. When the new admission comes, we always complete a head-to-toe looking at their skin, their cognition, their fall risk, bowel and bladder, all of the different systems for that patient. Some of the items include the code status, any cultural preferences, any dietary needs that are specific, any specific risk factors that are applicable for that patient, for falls, skin breakdown, any type of hydration concerns, any type of medication that the patient may be taking that increases their risk for adverse effects, and also what is the skilled need, or why is that patient admitting to your facility. Finding that answer is really going to help drive your care plan. So if that patient is coming to you for diabetic management, they're new diabetic, they're very brittle, you're going to see that the care plan development is going to be centered around some of those items related to diabetes. For instance, the resident may need a consistent carbohydrate diet. They may also require insulin injections, so they might be at risk for skin breakdown due to diabetes, maybe at risk for falls due to either a high or low blood sugar. So really looking at that main reason why the patient admitted to your facility and incorporating that into your baseline care plan. Always remember the baseline care plan is driving the care that that patient is going to receive for the first 48 hours. When the MDS coordinator or other members of the IDT, the ADON, DON, unit managers, when they come in and meet with that patient, they may add more to the baseline care plan. They may update, make any corrections, but they will definitely be reviewing that baseline care plan that the nurse created on admission. The admitting nurse who creates the initial care plan, sometimes you'll find they struggle finding the risk factors. So I always tell them to keep it simple. What we need to do is really look at your assessment as the admitting nurse. What risk factors did you identify just during that initial head-to-toe? Chances are they have identified several areas that they're concerned with. For instance, the resident might be at risk for skin breakdown due to hematopoiesis on the left side. So the admitting nurse may decide that they need to reposition the bed so the resident is able to move on their own. They may also decide that we're going to have a pillow to elevate the heels or float the heels so that that leg isn't just laying on the mattress. So there's things that the nurses will do, and we need to ensure that we're taking credit for that. Also, if she determines as the admitting nurse that the patient should be on a turning and repositioning program, she will care plan that and communicate that out to the floor staff who are providing direct care. So always providing education to your floor nurses is very helpful so they feel confident in developing that care plan within the first 48 hours. I've even seen templates that are set up to help the admitting nurse as far as which care plans need to be created and to help with interventions to assist them in thinking outside of the box to get interventions that work for that specific patient. When the MDS coordinator and the IDT come in the following business day, they're going to be reviewing this baseline care plan and making adjustments as necessary. The team will really be going through the chart to determine those comorbidities, and we need to care plan those when we receive those during that morning meeting when we're really looking at those skilled needs because we are providing care. It If you would like more information on care planning, please visit our website and request more information. And if you're new to the YouTube channel, click that subscribe button and ring the bell so you're notified when we release further videos. And thank you for watching and requesting videos. We love making videos that are requests. It's one of my favorite things to do because I want you to be successful. And as always, I hope you have an amazing day. And thanks for learning with Jen.